Hi, my name's Molly Shevill.
And my name's Sam Hall.
And we are accredited exercise physiologists at Aspire Fitness and Rehabilitation. As exercise physiologists, we specialise in clinical exercise interventions. We work in a variety of different areas and assist people at a high risk of developing or with existing chronic and complex medical conditions and injuries, individuals requiring rehabilitation following injury and/or surgery, and strength and conditioning. Accredited exercise physiologists are required to complete a 4-year university degree in the area of clinical exercise physiology and are required to meet extensive accreditation processes. Recently, Aspire Fitness and Rehabilitation and Queensland Sports Medicine Centre partnered with the Leukaemia Foundation for a pilot exercise intervention as an adjunct to medical management. This program was called Fit to Thrive. It follows from research commissioned by the Leukaemia Foundation into survivorship that identified this as an area requiring attention. The program needed to be sustainable and aimed to alter the well-being of patients dealing with many things. Fatigue is a major issue in patients with blood-borne cancers, so in many people it would seem counterintuitive to exercise at this time. Research, however, has shown that exercise is combative to many side effects of these cancers. The Leukaemia Foundation commissioned the program to improve the lives of people under their umbrella. They generously provided this as a free program for 30 people willing to commit themselves to Fit to Thrive. The Fit to Thrive exercise program was aiming to support growing evidence of the benefits of physical activity for people living with blood-borne cancers. This project retained numerous objectives. It hoped to assist patients individually and within a group setting. This objective is obviously best practice, and we believe this is achieved by providing tailored patient care. It is our clinical opinion that this is superior to a generic one-size-fits-all approach. Finally, efficacy is important, so Fit to Thrive will provide data for further research into the benefits of exercise for this patient group.
So far, this Brisbane-based pilot program has gone extremely well, and we wanted to find a way to deliver the program to people outside metropolitan areas that typically have a higher service level. We designed and structured the administration to enable consistency of the measures taken while allowing scope for other accredited exercise physiologists to program with autonomy. We are very excited to be involved in this DVD, and we hope you too will enjoy the benefits of this fantastic program.
The principles of any exercise physiology program is to improve the well-being and functional level of the patient involved. Fit to Thrive uses a progressive system of exercises and strategies designed to optimally improve the quality of life of the participants living with blood-borne cancers. The health of patients with blood-borne cancers alters week to week, and hence the program needed the ability to transition up or down to suit individuals' levels of health that day, competency and confidence. The program has been designed in accordance to the current exercise guidelines in Australia. The exercises have been specifically chosen to target major muscle groups in a way that positively impacts posture, function and fatigue.
We have designed this program to try to accommodate participants living with all subtypes of blood-borne cancers and as those mentioned above in metropolitan, rural and remote settings. This includes people about to have chemotherapy treatment or people preparing to have a stem cell transplant. People who have completed treatment or are having ongoing treatment and looking to improve their functional ability. We specifically do not want to make Fit to Thrive specific to any specific type of blood-borne cancer or position along with the treatment pathway. It is therefore open to everyone under the proviso that the specialist has provided clearance. Through this DVD, we will firstly outline how to monitor your exercise intensity easily throughout sessions. We will then go into detail on the different types of training, including demonstrations on how to complete various exercises. The program is divided so that exercise can be performed in a lying, seated or standing position. This design allows for days when symptoms such as fatigue are worse and enable you to still perform some kind of exercise. Further key points in the design include altering the frequency of program between once per day to 3 times per week, depending on the individual. The critical message is to be cautious and start slowly. Remember that something is always better than nothing.
As discussed, prior to commencing any type of exercise program, either during or after treatment, it is important you talk with your oncologist, your haematologist or your general practitioner about any precautions you should take. If you have never exercised before, or if you have not exercised in a long time, we recommend starting slowly and building up gradually. The doctors will always be the centre of your treatment paradigm and will recommend a program if they feel it is appropriate. In saying that, we would recommend further discussion with your doctor before starting and during the Fit to Thrive program if you experience any of the following: low white blood cells, so neutropenia, which puts you at an increased risk of infection; low red blood cells or anemia, which can increase your fatigue; low platelet counts, which increases your risk of bleeding and bruising; unusual or extreme fatigue; bone, back or neck pain of recent origin; unusual muscle weakness; shortness of breath or damage to nerves.
Fatigue is one of the most common treatment side effects. Carefully monitor your fatigue and make adjustments to exercise intensity and volume depending on how you feel. It is important to keep doing some kind of light amounts of exercise. Stopping your exercise will put you at risk of losing strength and fitness, which ends up contributing to making the fatigue feel worse. If you have low white blood cells, your immune system is compromised, and this increases the risk of infection. We advise you to consult your doctor before starting or resuming exercise. Red blood cells carry oxygen to your tissues and organs. When red blood cells are very low, they may be unable to put up with the increased oxygen demand during exercise. We recommend consulting with your medical team or relevant health professional for advice around exercise. Your platelets work to form clots in your body. When your counts are low, you are at increased risk of bleeding and bruising. For this reason, it is recommended that you avoid activities where you may be at a high risk of falling or injury. This may include something like bike riding. This may be an occasion also where you use resistance bands or bodyweight exercises instead of hand weights. Again, we recommend consulting with your medical team or relevant health professional for advice around exercise. Your specialist will be included in correspondence which will advise parameters for you to individually to ensure safety is highlighted.
For this program, there is no need to purchase a gym membership or expensive gym equipment. When completing the program, we suggest you wear comfortable clothing and enclosed comfortable shoes, preferably sports or running shoes. We will show you a variety of different exercises. Some of these exercises may require a small amount of equipment, for others you will need none at all. What you will need is a sturdy chair, for example a dining room chair, a towel, a small soft ball, broomstick, resistance bands or tubing, and small hand weights. In this program, you will learn about the benefits of different types of exercise. You will learn how to monitor your exercise intensity, as well as how to exercise independently. We hope we are able to give you an understanding of how to implement exercise and fitness into your lifestyle safely and successfully to make a positive change to your lifestyle moving forward. We absolutely love this program, and we are very excited to be given the opportunity to deliver Fit to Thrive to you.
If you are using the Fit to Thrive program remotely, there is a higher requirement to ensure exercise safety. When exercising, it is important to monitor your exercise levels, which help you ensure you receive the best and safest outcome from this program. There are a few different ways to measure your exercise intensity at home. We have included 3 validated testing measures that you can choose from, or you can use a combination of all 3. The first of these is the talk test. This is a very simple way to assess how hard your aerobic activity is. If you're able to sing, the activity is probably a little light. You should be able to carry out a conversation with a need to pause for breath from time to time. This is a moderate intensity. If you find it difficult to speak or can only provide one-word answers, then the activity is probably becoming too vigorous. It is recommended that you try and work at a moderate intensity during aerobic activity. The second of these is the rating of perceived exertion, or the Borg scale. An RPE is often used by exercise professionals to assess the intensity of an activity. It can be used during aerobic and resistance training. To use the RPE, you must ask yourself, how hard am I working? And then find the corresponding number that best describes what you feel. We use a range from 6 to 20, 6 being no exertion at all, through to 20 being maximum exertion, for example, a full sprint. It is recommended that you try and exercise at a moderate intensity. This should be somewhere between 11 to 14 on the RPE scale.
Heart rate is another way you can work out your exercise intensity. Your heart rate should increase in proportion to the intensity of exercise you are doing. For people who are on some medications, heart rate may not be as accurate a measure as some others. So it is best to confirm the heart rate range desired with your doctor first. If your rate becomes too high or too low during exercise, it is best to stop what you are doing, seek help and consult your doctor as soon as possible. To use this method, you must first work out your maximum heart rate. The basic way to calculate your maximum heart rate is to subtract your age from 220. For example, if you are 50 years old, subtract 50 from 220 to get a maximum heart rate of 170. This is the maximum number of times your heart should beat per minute while exercising. Once you know your maximum heart rate, you can then calculate your desired heart rate zone at which your heart is being conditioned but not overworked. It is recommended that you work at a moderate intensity, which should be about 60 to 80% of your maximum heart rate. To find your heart rate, you can use a heart rate monitor or you can do it manually. To check your heart rate manually, place 2 fingers between the bone and the tendon over your radial artery. This is located on the thumb side of your wrist. When you feel your pulse, count the number of beats in 15 seconds, multiply this number by 4, and this will give you your number of beats per minute.